Assalamualaikum warahmatullahi wabarakatuh and good afternoon, sir. I am Leia Dilopang Ahmad and I am here to demonstrate about deep breathing and coughing exercise. Now let's begin the procedure. So the first thing that you need to do is you need to identify the patient and introduce yourself. So ma'am, I am Leia Dilopang Ahmad and I am your nursing student for today. And next, you need to explain the procedure to the patient. So ma'am, can you state first your full name?
I am Cindy.
So ang gagawin po natin ngayon, ma'am, is deep breathing and coughing exercise that is to promote lung expulsion and airway clearance. Then we need to make sure that yung patient is in a comfortable position or a semi-collar position. So yan po, ma'am. Thank you. Now, in diaphragmatic or abdominal breathing, the first thing that you need to do is kailangan you need to instruct the patient to put her hands on the abdomen, just below the ribs, and the other hand in the middle of the sternum. Next is, instruct natin yung patient na mag-inhale and exhale. Make sure na yung lips niya is naka-pursed lips. So, ma'am, ganito po yung gagawin niyo. You need to inhale through your nose and then exhale through your mouth and make sure naka-pursed lips po. So, okay, ma'am? Inhale and then breathe out through your mouth while pursed lips. Ganun po. So, ulitin po natin, ma'am. So, inhale and then exhale. Isa pa. Inhale. Exhale. So, repeat the procedure for 1 minute and with a rest period of 2 minutes, and work out to 10 minutes and do it for 4 times a day. Now let's proceed to pursed lips. So same lang, instruct natin yung patient natin na mag-inhale through the nose and then breathe out through the mouth and make sure na naka-pursed lips. So ma'am, again, ulitin po natin. Inhale through the nose and exhale through the mouth. Parang ganito. Then, okay, ma'am, i-repeat po natin na 3 times. Inhale. Exhale, inhale, exhale, inhale, exhale. So in coughing exercise, we need to instruct the patient to inhale and exhale 3 times, and then in the third times, i-hold niya yung breath niya in the count of 2, and then spit niya yung mucus niya, and we need to make sure na secure siya sa dito sa container natin. So, okay ma'am, inhale and exhale 3 times, then pagka third times ko is hold your breath, and then mag-cough po kayo 2 to 3 times po. Okay, ma'am? So, after 2 to 3 times coughing po, ma'am, dito nyo po ilalagay yung mucus nyo. You have to make sure na secure po, ma'am. So, inhale, exhale, inhale, exhale, naka-pursed lips. Yes po, ma'am. Inhale, exhale. So, for the third times, hold your breath at the count of 2. So, 1, 2, exhale po, ma'am. So, after natin makuha yung container, we need to make sure na i-label natin siya the date and time, and then the sample, para saan yung sample, and then ibigay natin sa laboratory. We need to make sure na secured natin siyang ibibigay. Auscultate natin yung patient using stethoscope para ma-examine natin for the changes, if there's a changes a deep breathing sound. And then, examine the sputum for consistent odor, color, and amount, and we need to make sure to document the procedure. That's it.